everybody. My name is Lauren, and I chose Wernicke-Korsokoff syndrome for my project. I hope this video is informative and it lets y'all know a little bit about the disease and who it affects. And hey, it might even help y'all maybe see some of the things that you might be doing wrong or know someone that might be having some of these symptoms. Maybe they can ask their doctor a few questions. And I chose Wernicke-Korsakoff syndrome. It's one of the 10 forms of dementia listed. Alternative names for the syndrome are Korsakoff psychosis, alcohol encephalopathy, and Wernicke's disease. What exactly is Wernicke-Korsakoff syndrome? It's a chronic memory disorder caused by severe deficiency of the thiamine, which is also known as the B1 vitamin. So now that I've talked about thiamine and B1 vitamin, of course, you're going to wonder what exactly does it do? Vitamin B1 actually helps brain cells produce energy from sugar. When levels fall too low, the brain can't produce the energy it needs to produce the necessary nervous system functions. And of course, no sugar, no production, doesn't function properly, does it? The most common cause of this disease is alcohol misuse. Other symptoms or issues that can also cause the disease is going to be AIDS, chronic infections, poor nutrition, anorexia, overly stringent dieting, starvation or weight loss surgery, which is also called bariatric surgery, uncontrolled vomiting, kidney dialysis, cancer, overactive or underactive thyroid, and there's a few other symptoms or causes that can cause this disease that I just haven't listed because they're just not as significant as some of the ones that I just talked about. Scientists are still really unsure why the misuse of alcohol specifically can cause lack of thiamine in some alcoholics, whereas others are more affected with heart disease, kidney and lung, liver failure, stomach issues, intestine issues, and other issues with the body that alcohol will generally affect more so than the thiamine. They also aren't sure why the Korsakoff syndrome actually affects the brain specifically rather than other bodily functions. Severe thiamine deficiency, it disrupts several biochemicals that play key roles in the carrying the signals among brain cells, more specifically in the storing and retrieving of memories. So you're going to have memory loss. You're not going to be able to make memories once you're diagnosed with this disease or in the very far stages of the disease. You're not going to be able to make any memories. You might not even be able to retrieve any of the memories that you have stored. As far as gender, racial, or ethnic differences, scientists really haven't been able to find too many differences. However, they are able to see that 1 in 8 people with alcoholism actually have this disease. 2% of the general population have the disease. With lower and poverty stricken people have the disease a little bit more so than others just because they're a little undernourished compared to the other general population. Also, it affects more men than it does women, typically between the ages of 45 to 65. So it's not really going to be considered an older disease. It's going to be affecting younger people than the older generation. It's going to affect people that have a long history of alcohol misuse. And since the age is 45 to 65 for men, it'll actually affect women a little bit earlier just because they have a lower tolerance to the effects of alcohol misuse. Some of the symptoms, first off, I'm going to talk about Wernicke encephalopathy. This is actually the beginning stages of the disease. In this stage, and they're going to have confusion and loss of mental activity that can lead to coma and even death. They have ataxia, which is a lack of muscle coordination that can cause leg tremors. They're also going to have alcohol withdrawal, especially if they're trying to quit drinking. You're going to have visual changes such as abnormal eye movements, double vision, eyelid drooping, and nystagmus, which is the back and forth quick movement of your eyes. The symptoms of the Korsakoff syndrome, which is actually the furthering of the later stage of the syndrome, is going to be inability to form new memories, which we kind of talked about already. You're going to have a loss of memory, which is going to be range from anywhere from mild to severe. And you're going to have some issues of confabulation. What that is they're going to be making up stories. And they might not realize that they're making up stories. They might really believe that whatever they're saying is true in their eyes. They don't realize that it's just something that they're adding into the story to make the story flow through a little bit more. They also might have hallucinations. And these are instances where they see or hear things that are really not there. Exams or tests that can help diagnose this syndrome. Some of the ones regarding the nervous and muscular system is going to be eye exams. They can diagnose some abnormal movement, the nystagmus, the eyelid drooping, things like that. Also, do a reflex test. Most of us that have had any form of physical have had a reflex test done. Another thing they're going to check is going to be your pulse. Extremely fast heart rate, possible symptom of the disease, low blood pressure, low body temp, kind of other factors that could possibly be symptoms of the disease. Also, muscle weakness and atrophy. Atrophy is a loss of muscle tissue and just tissue mass in general. Also, they can have a possible problem with their walk, gait, and coordination. Another symptom that they can use to possibly diagnose this disease, especially if someone looks a little malnourished, they can check the serum albumin level, which it checks the general nutrition of the person. They can also check the serum vitamin B1, and that's going to be checking their thiamine/vitamin B1 levels. The other test they can use is the transcutaneous activity. That's done in the red blood cells, and this basically relates to someone that has a thiamine deficiency. Last but not least, if all of those symptoms still don't prove to show 100% that they do have the diagnosis of Wernicke-Korsokoff syndrome, they can also do a brain MRI, which is going to diagnose any lack of brain tissue or brain tissue change that they can actually see on the MRI. So there's going to be some significant changes. Of course, the treatment, the number one goal is the prevention of it getting worse. Some people may need to stay in the hospital during the early stages. That way they can help control the symptoms. They're going to be monitoring special care, of course, if they're comatose, they're lethargic, or they're unconscious. Vitamin B1 can be given to people with this disease that will help improve their confusion or their delirium. The vitamin B1 will also help with difficulties with their vision or eye movement, and also help with their lack of muscle coordination. Although vitamin B1 will help with some of those, it won't help with their memory loss. It won't help them bring their memories back, and it won't help them really create new ones. Of course, you're going to want to stop alcohol use. That can definitely prevent more loss of the brain function and damage to the nerves that it's causing already. You want to make sure that you eat a well-balanced diet, nourishing diet at that. And this can also help with the prevention of the disease. However, if they don't stop their alcohol use, it's not really going to help that much. It might prolong it a little bit. Some possible complications of the disease, of course, or treatments of the disease is going to be alcohol withdrawal. Anyone that knows an alcoholic knows that when you take their alcohol away, they're not a happy person. So it's going to be the same thing whenever you try to do the treatment. They're also going to have difficulty with personal and social situations. They're going to kind of be a little bit awkward. They're not going to be too comfortable being in a personal or social situation where maybe the spotlight's on them or they're really in part of a conversation that they may not be comfortable with. Also, they can have injuries or falls caused by the disease. They can have permanent alcohol neuropathy, which that is a lot of nerve loss and, of course, your hands, legs, arms, feet, your appendages. Permanent loss of thinking skills. They may not be able to give them a simple math problem. They won't be able to comprehend it, or even just comprehend a conversation that they're in. They have a permanent loss of memory, meaning they don't have short-term memory, they don't have long-term memory. You can have a conversation with them, and 2 minutes later, they're not going to remember what you talked about, or even if you had the conversation. They're also going to have a shortened lifespan. In the story, alcohol misuse and some of the other things that cause this disease, prolonging those uses, it's going to cause you to have a shortened lifespan. Of course, prevention, I've already talked about. No alcohol. Simple as that. If you do have to have alcohol, you do choose to have alcohol, please make sure you do it in moderation. Also, if you or someone you know is a heavy drinker and they don't want to quit drinking, you can always substitute thiamine into their diet. Also, you want to make sure that you eat a well-balanced diet and live as healthy as possible. Meaning, if you choose to diet or you choose to partake in the bariatric surgery, make sure that you follow the diet right and diet the right way. Don't starve yourself. Don't become anorexic or bulimic. And if you do have the surgery, make sure you follow the physician's instructions and take the supplements needed. We are trying to help you prevent any further negative effects of having the surgery. The outlook or the prognosis of the disease, without treatment, Wernicke-Korsakoff syndrome can get significantly worse and can eventually be life-threatening. With treatment, you can control it, and you can also slow the symptoms and possibly stop the progress of the disease in general. So overall, you see that dementia has numerous forms, one of which I just went over. affects young people. It's not just an old disease. So make sure that if you know someone or you yourself are a heavy drinker and misuse alcohol regularly, please know that this is something that can happen to you or someone that you know. And the best thing to do is stop drinking and take care of yourself and lead a healthy life. Thank you.